for you, but I also will try not to trick you either. So just be neutral and agnostic on Halloween from this perspective. It's a little past 9. I don't know where the committee members are, but we will go ahead and get started. I've got to keep this train rolling. I got a full day. I have to be in Dublin at 2 for a meeting there. So if you all will bow your heads, I'll open us up with a word of prayer. Heavenly Father, we thank you for all the blessings you give us. We thank you for your Son, Jesus Christ, and your redeeming mercy and the salvation you offer us through him. Lord, we pray for the citizens of Israel and for their military forces. We pray that you will put your hand of protection around them and that issue will be resolved quickly, Lord. We also pray for the folks in Maine that have suffered such a devastating tragedy there, and those families that suffered a loss. Pray that you will comfort them and that they will feel your presence and your peace, Lord. We thank you for the leadership of the state of Georgia. Pray a blessing on the leaders in Georgia and give them wisdom and discernment and courage to do the right thing, Lord. And we pray a blessing on all the people present today and the families represented here today, and please give them safe traveling mercies as they return home. All these things we ask in your name. Amen. Hey, Senator, how are you? You've been traveling a lot. I'm glad you're able to join us this morning. So the roll call will be simple. We have Senator Sonia Halpern here and myself. And with that, we'll call the meeting to order. Our first presenter is my friend Shay Ross Smith. She's Director of Governmental Relations for Kaiser Permanente, and they are doing some unique things in Virginia. I believe she told me that I thought would be of interest to us here that we may want to consider adopting in Georgia, related specifically to the military. So go ahead and tell us what you all are doing, please.
Thank you so much. I appreciate the opportunity to be here this morning to speak to your committee.
Well, I got to turn you. Hang on just a second. Sorry.
Okay. And with me, I have Jamal Lofton. He's actually here via Zoom. He is in Virginia and is a part of this program as a KP employee as well. So at the end of this conversation, we're going to have Jamal speak anecdotally about what's going on in Virginia. I'm going to go through the slide deck a little bit. I don't know if we have that, or I can pull it up too on my end if I need to. I'll get started.
I do not know.
It's okay. Oh, there we go.
Okay, and be sure and speak into the mic because we have offline people.
Perfect. Is that better?
It's better.
Okay.
Yes, ma'am.
Okay.
Thank you. And
You're welcome.
We're on a time limit too. So
yep, I'll be fast.
All right.
Yes. So just like you said earlier, in Virginia, they passed a law that allows for military retirees, military veterans, a different system for them to enter the healthcare workforce. And first and foremost, I need to acknowledge the great things that the Georgia legislature has done for military veterans in this space. We have expedited licensure for military spouses. We have expedited licensure for military veterans. This program is in addition to that and would be like a cherry on top of the great things that Georgia has already done. The mission statement in Virginia really aligns with what we've already done in Georgia. I did want you guys to see the enabling legislation that the Virginia legislature utilized for this program. It started out as a pilot program, and then it was successful, and they put it permanently into law. But it allows for military medics and military corpsmen who are providing healthcare services in the military when they leave the military to enter the civilian workforce without having to go through the civilian credentialing and education process or licensing process. So there are 3 employment pathways in the Virginia program. The first path is specifically for healthcare workforce. This is for individuals who have provided healthcare services within the past 12 months in the military. They're leaving with a good understanding of healthcare. They've been educated in the military, and they can go right into the healthcare workforce in the state that they're in. So they're doing this in Virginia. They are aligned with the healthcare services that they're providing, and there's no gap in their employment. The second path is actually outside of healthcare. So Virginia focuses also on individuals who may not have provided healthcare services within the past 12 months. So they would skip any type of licensure, occupational licensure for like HVAC. So that's path number 2. The third pathway for these individuals is really aimed at healthcare leadership. It's for people who are experienced leaders in clinical operations in the military. They maybe have a master's degree. They have been in leadership positions, and it places them in leadership positions within healthcare, whether that's clinical, administrative, for a hospital, for a health plan, etc. The qualifications in Virginia, just like I said, not only is it the individual who's going into the healthcare setting must have performed healthcare services within the last 12 months, but there's also an analysis of scope of practice. So seeing what the individuals have done in the military to be sure that they are not working outside of their scope. That is established through the Department of Veterans Services in Virginia, as well as through the healthcare entities that they are working for. They create a scope, and then they place these individuals in the appropriate positions once they leave. So what's the process? How does this actually work? In Virginia, the Department of Veterans Services first starts with recruitment. They look at veterans who are transitioning, who are honorably, generally discharged from the military, and who are looking for a healthcare position when they leave. They review their applications, they review their scope of practice, and they determine, is this individual qualified? Can they perform these skills on civilians in a civilian setting appropriately? And lastly, the Virginia Department of Veterans Services then refers them to healthcare entities that are a part of this program. So in Virginia, KP is a part of this program. We work with the Department of Veterans Services. We get referrals of individuals who can come in and practice at the appropriate scope on day one. Again, not having to go through the same civilian occupational licensure or credentialing process, education, etc. These are some of the positions that KP has hired in Virginia or that KP has utilized in Virginia. These are some of the positions that you could, if the state of Georgia were thinking to do this, that we could look at as well. I just want to look at the next slide quickly. So this is from AHIC. It's a graph in 2028, our workforce shortages, and it's a little bit blurry, but it aligns very well with the positions that were listed on the last slide. This is the last thing that I'm going to talk about, and then I'm going to turn it over to Jamal, but the outcomes. I think this is really impressive. So this program, like I said, started in 2017. So from February 2017 to April 2023, there's been 564 veterans that have been placed in positions in Virginia through this program. To me, that is a large number of individuals who are filling workforce gaps in Virginia in healthcare. And I just thought that that was really impressive that the program has done this. Jamal, what did I miss? Fill in my gaps, and please let them know how the program works with you in Virginia as well.
Yeah, thanks, Shay, and good morning, everyone. Is my audio okay, Shay?
I can hear you.
Good morning.
Yep.
Good morning, everyone. And thank you to the Senate for having me this morning from sunny Virginia today. Yeah, Shay, I think you hit it. I just had a couple of things that I just wanted to kind of highlight about the program. First and foremost, it removes barriers for veterans transitioning out of the military. I am a prior hospital corpsman. I was a hospital corpsman for 6 years in the United States Navy before I became a naval officer and retired in 2018. And this program really just removes barriers so veterans transitioning can go right into the workforce. And I think for Georgia, why this is important is because I think you all know Georgia is like one of the top 5 states in per capita members serving in the military, right? So this is a good way to get your veterans back into the state working, because a lot of veterans have a hard time finding, meaningful employment, especially with this program. And again, it just removes barriers. It's with delegated tasks. So there's a general scope of practice that our clinical practice leaders, work with the Virginia Department of Veteran Services to identify tasks what we need for specific positions. And the Department of Veteran Services, they do a really good job in translating a lot, of the military jargon and things that may be allowed in the military, and really seamlessly transitioning that to the civilian healthcare sector. And it's just been a win-win for the state and for, healthcare organizations in Virginia.
You guys have any questions? I will say, this presentation digitally, there are links right here that have the links to the skill requirements for this program, as well as a link to the program's website itself that has a significant amount of information, if you're interested in learning more. And we're happy to answer any questions that you may have.
Thank you, Shay. Georgia has a vector center in Warner Robins that was stood up, I don't know, probably 8 years ago, 10 years ago, to help transitioning military get into the private sector workforce or get into the workforce. And this would align perfectly with their mission. I think they've also stood one up in North Georgia in the last year or two, a vector center. Cobb County. Okay. So I'm thinking on one of your slides, you said the process, the recruit part. I'm assuming in Georgia, the vector center could be the recruiting arm. It looks like to me that maybe the state in Virginia is doing the recruiting.
That's
initially.
correct. Yes.
So that would dovetail in great with the vector center, I believe. And Colonel Ross is doing a good job leading that here. Shay, tell us, or your colleague, tell us what the specific experience has been with Kaiser Permanente with this program.
So Jamal can probably speak to that better than I can. So I'll let him start and then I can wrap up if necessary.
Yeah, thanks, Shay. Our experience has been great so far. We are one of the most recent signatories with the program in Virginia. And our first hires have been great. They've transitioned right into urgent care tech positions, which is basically like a medical assistant with advanced scope of practice. And there were hospital corpsmen, which goes right into this program. A lot of skill sets, right? So in the military, typically a hospital corpsman, speaking from my experience, you get your EMT basic certification, they do sutures, they work directly under a physician or a nurse. So it's been great so far. And we've done many other interviews to get new transitioning veterans within this area. So it's been a really good experience so far.
Okay. I believe I asked Shay before with the meeting, and I think she told me there was no testing requirement.
That's correct.
In Virginia.
Yeah,
That's correct.
So, okay. Any questions from the committee members? Thank you very much.
Thank you very much as well.
All right,
Thank you.
next I want to introduce Spencer Johnson. He's a land surveyor. He's a constituent of mine, a good friend of mine. Known Spencer a long time. He's here with the Surveying and Mapping Society of Georgia. I'll let him introduce his colleagues. And this is a refreshing, I think will be a refreshing presentation because they have initiated a desire to streamline their licensing process and lower the barrier to entry for their industry. And that's a refreshing. We have not heard a lot of that from other industries, unfortunately. A lot of protectionism or something going on there. But anyway, I'll turn it over to you, Spencer.
Yeah, as Larry said, I'm Spencer Johnson. This is Trent Turk and Mark Chastain, and we're here on behalf of Surveying and Mapping Society of Georgia. We've got an initiative to remove barriers for the licensure of surveyors in the state of Georgia. With that, I'll turn it over to Trent.
Oh, great. Thank you. Senator Walker, thanks for inviting us to come speak today. Spencer is chairman of our legislative committee. We represent over 500 surveyors in the state. It's Surveying and Mapping Society of Georgia. We've created a task force to address the declining number of surveyors in our state. And that's what we're trying to remove unnecessary barriers that we can perhaps streamline that efficiency and get more surveyors in our state. Let's see, can I toggle to the next slide here? Yes, I can. So right quick, we wanted to run through, there perhaps are people that don't even know why surveyors are licensed. And I think first and foremost, we need to know that surveyors are licensed from a public safety and protection standpoint. And if every time we survey someone's property and establish their boundary lines, it's not just that client we're working for, it's all of those adjoiners that are even unaware we're there. So the state is there to protect the public and make sure those lines get established correctly. That's the first and primary reason that we do that. Additionally, we're involved in infrastructure and development, and when heavy concrete things get built in the wrong place, that's very expensive. And we want to be done right the first time. We're also involved in zoning and land use regulation, environmental protection, land taxation, legal documentation, very complicated issues that we get involved with, all necessary that the state licenses us so that we do protect the public and it doesn't get done incorrectly. And it also keeps things out of court. We don't want problems ending up in court, bogging down land transactions, clouding title, clogging up the court system. And trust me, there are plenty of erroneous surveys that end up in court. So these are reasons why we're licensed, and we have to protect that. We can't yield on that, but we still need to do some streamlining. Our numbers are declining in land surveyors in the state, and that is resulting in delayed projects and delayed real estate closings, and then even in slower economic development. Imagine developers not being able to find surveyors to create subdivisions because they're backed up more than 3 months before they can even look at the project. That's going on all over our state right now, and it's only getting worse. Further, existing land surveyors are struggling to find employees, and especially those that might be wanting to go for licensure. And that's all got to do with the difficulties in upward mobility in our profession and how challenging it is to do it. Many land surveyors that do get in that profession end up getting discouraged and even exiting it after they find out how hard it is to get a license to survey. So that's led us all to believe to look into this task force that we're a part of. And we have 7 or 8 members on this task force looking at this. We've dug in over the last year and figured out what are some things we can do that will streamline the licensure and yet protect the quality of licenses that we are issuing. And these are the things that this study committee, after many hours of monthly meetings, have come up with, we believe would help us produce more land surveyors in our state. The first one is something called decoupling, or decouple the land surveyor examinations. And these examinations are issued by NCEES, which is the National Council on Engineering Examinations. Mark would know.
Examinations for engineers and surveyors.
Yes. And that's issued at a national level. And it's a very academic based test. You have to really bone up for it and study a lot of coursework to be able to pass that test. It's in fact more academic than it is experience based. So we're following the lead of other states that have decoupled it from the experience component. So when a aspiring land surveyor gets his education, he can immediately sit for the surveyor in training, and then right after that, the land surveyor exam. That won't give him a license or her a license, but it will get the hook in them. Okay, I've got this license. All I've got to do now is complete a 2-year apprenticeship to get my license. As opposed to now, they have this big test looming at the end of their experience where they have moved on in life, they've gotten their experience, and they got to dig the books back out when they finally qualify for the test. So that's decoupling. We also looked hard at relaxing experience requirements to a point that won't compromise the quality. And I'll show you more about that in just a minute. We also are looking at giving credit for more credit for experience that's gained prior to passing the education requirements and the testing. And that we'll explain more about that too. We also are preserving a high school route. We have that, and other states have eliminated high school education only as a possible path. We're keeping that as it is now, and you'll see more about that in a minute as well. Something we've done since we are decoupling, hopefully, and moving the education requirement, the testing requirement to be right past the education, we're formalizing an apprenticeship program of 24 months that has to be completed after obtaining the passing grade on the license test. And that'll be administered by our state board under our guidance and suggestions. We're not going to dig on this slide, but I did want to show it to you. This is a tool that we have developed for the professionals and aspiring professionals in our profession. It shows the three silos, the three different pathways: high school, associate, or bachelor degree education, and the various years of required time. The blue bar at the top shows where we move the past NCEES exams up just below getting done with your education, and puts all the experience after those exams. This one summarizes what was on that slide in a better way. So you can see the blue bars are the estimated years when someone sets foot in a surveying office and wants to get their license. You can see that we're decreasing the number of years through all of these efforts. We're streamlining it to that point to obviously create more surveyors is our goal here. And, without digging in too far in that, this is going to work a lot better for us, mainly reducing these experience requirements in years, but also the decoupling gets our hooks in aspiring land surveyors early. If they get that degree, if they get that education and testing passed, all they've got left to do is their experience. And that apprenticeship program will ensure that they get quality experience before we issue them a license.
Increase our pass rate also.
Oh, yes, and it'll also increase the pass rate. We're hoping the pass rate is not that great now. And we're hoping to increase the pass rate because remember that test is academic based. So if they take the test immediately after getting their academics, the passing rate is going to be higher than if they have to go drag the books back out several years from now.
After life happens and they got 2 kids down the hall.
That's right.
Can I ask a question about this slide?
Sure.
I understand letting them take the test really immediately after the education requirement. This Georgia state specific exam says during or after last 6 months of apprenticeship experience. Can they get their apprenticeship on the front end?
I'll let Mark. Now, Mark, I didn't mention, Mark was on our state board for 18 years. And he's a board member emeritus now. There's nobody more knowledgeable than Mark about this. I'm gonna let him address that.
Well, thank you. And thank you all for listening to us. And I don't know that I'll live up to all that, but to really give you the full flavor, I also spoke last week as an emeritus member. The board still calls on me sometimes, especially the executive director. And we bounce things off, and they're going through a transition and a lot of computer software. And he and I spoke to make sure that these changes would not cause any hiccups or additional expense or trouble on their office. And this will actually work out real well. Right now, we have a really complicated, to a lot of people's perception, really complicated regime to become a licensed surveyor, as far as how the education, the experience, then the exams all tie together. And part of the complicated slide before is even watered down from how complicated you might say it really is, because also in that, with the 3 different routes being the high school education plus 18 semester hours of surveying coursework in college, or an associate's degree or a bachelor's degree, which also has to have the 18 semester hours, a certain number of the years have to also be in a responsible charge, kind of like you're not really shadowing, but you're basically like an apprentice or an intern, but it's not called that in the law, and it's kind of a vaguity. So, right now a high school educated candidate has to have, I believe it's 6 years in responsible charge. And that gets kind of blurred because it's really hard to define and hard to track. So what we're proposing with this is, when we streamline a lot of these things, one of the big streamlines is the delay between when you pass the first test. Right now, your clock restarts and you have to get 4 more years of experience. And that's become a real impediment to people from in-state and out-of-state that have like a degree in something besides surveying, education, business, anthropology, or whatever. Now they're kind of reset to be on an associate's degree equivalent. And then they have to take that first test and then wait 4 more years. So it's really turning what should be 4 years into 7 or 8 years in reality, not what the code currently calls for, but in reality. So what we came up with that other states have tried in other professions, including the technology college system here in Georgia, is focus on an apprenticeship where you've got a more focused experience. It doesn't have to be for as long. And what we're calling for is 2 years of that overall experience will be at the end after the education requirements have been met. And it'll require a surveyor to say, hey, I'll sponsor you. I'll help you learn what's going on. I'll be responsible for you learning this, because right now you just got to get 3 surveyors to sign off that says, hey, I know this guy. And so by lowering some of the education requirements and streamlining this and getting the actual time for licensure down to what the code calls for without these bureaucratic delays, we feel like there's a big need for a higher quality of experience to be imparted on an individual before they're licensed to go out and offer their services to the public. I hope I didn't overcomplicate that, or if I failed to answer that, please
So the
follow up.
question was in regards to the state specific exam,
Yes.
right?
I
And
totally
and
missed
so hit that.
I apologize. As he said, right now, you have to get all the experience. The final step is you take the NCES National PS exam, Professional Surveyors exam, and the Georgia specific exam. And what the decoupling does is kind of in 2 flavors. One, the national exams can be taken as soon as the education is in place. The state specific exam is more tailored towards practicing in Georgia. And instead of having to get all that experience and then wait for the testing cycle that can be months or even a year, the state specific exam would not be eligible on the front end while the education's there. It's more practice based, and that's to be taken during the last 6 months of the apprenticeship period, which is the last 2 years of the whole endeavor. So they won't have to wait on results to get back, but they'll wait till near the end of their apprenticeship, which is when they'd be the most prepared to take the state specific exam.
And that,
My question is this: if let's just look at the associate degree track, it says 60 months of total experience, 24, which has to be an apprenticeship. Could you do your apprenticeship part on the front end of that 60 months, or it has to be on the end of the 60 months?
The proposed language is it could be done anytime after the minimum education has been achieved, just like taking the test. So you could take the test and start the apprenticeship at the same time on the front end of the experience
Then go ahead and take the Georgia specific
in the
in
last
the
6
last
months of
6
that.
months of the 24 months.
Yes,
And then you still have to complete the rest of the experience requirement of 60 months.
that's correct. So yes, sir, it is technically possible to do that. Typically, you would see someone with less experience being, on the lower end of the skill and assignment level and working their way up, so that the apprenticeship would probably naturally be at the end of the experience engagement, but it would not necessarily have to be. And for folks, especially, the last presenter reminded me of a lot of the military applicants that we processed when I was on the board. If someone has been I know a young man who was in New Mexico in the Army in geospatial intelligence. And when he was in on leave, he was asking me a lot of questions that sound like what I do every day. So there's valid experience that's being gained that currently people aren't really able to get credit for. And by shuffling this and removing some of these barriers, that experience will be able to come home to Georgia and
Okay.
possibly allow somebody to jump into their apprenticeship just as soon as they get their education requirement met, as you were suggesting.
All right, Senator Halpern. Hang on, what, Mike, 9?
Hello. On the same topic, I do have one other question just because I want to make sure I understand. So if I am a high school graduate or have a high school diploma or a GED or an associate degree or a bachelor degree, and let's say it's not in any subject whatsoever that has to do
Right.
with this. In all three of those cases, I must acquire 18 semester hours of specific land surveying
That's right.
education.
Yes.
Now on your proposed thing, now I pass my national exam. Now I need the experience part. I am curious as to why the months of experience is different based on whether I have the high school diploma, the associates, or the bachelor's degree, even if, again, those right, those
Right.
18 hours are the same, but I'm wondering why the experience is 96 months, which is 8 years, 5 years, 3 years.
Well, I can summarize it. The profession places a high importance on higher education. It yields much better candidates for licensure, and the tests themselves are actually they're written around someone having a 4-year degree. Right. So we're preserving this path, but it is a greater challenge
Okay.
because of the testing that is required to be passed. And we don't have the numbers in front of us, but they're available to show the passing rates. And so this is we're actually less than a lot of other adjoining states that require it. So we're being aggressive in our timelines compared to other states in this regard. Mark, you got anything to add to that?
I'll try not to talk too much, which, as you can tell, is a problem of mine.
We were scared to even bring him.
Yeah. Wouldn't have been a bad idea, but land surveyors, a lot of people don't understand what we do. A lot of people just associate us with the guy in the orange vest on the street corner, and that's definitely part of it. And gathering accurate data is a very, that's the foundation of our profession. But especially as the world gets more complicated and property becomes more valuable and transactions and regulatory law becomes more and more complex, the 18 semester hours is one of the lowest in the country that's required. Most states, including I think all of our adjoining states except for North Carolina, require a bachelor degree. And the wisdom in that, if you want to call it that, and for years we lobbied for that in Georgia and it never happened. But the reason for that is that more than just the nuts and bolts, that those 18 hours teach an individual how to physically go process this data and make the maps and the reports, is the ability to communicate that and to really understand what they're doing in the bigger picture. And that's probably one of the weaknesses that we see in Georgia from not having the degree requirement. But if we did, we'd be in a lot worse shape than we are now.
Yeah. As a matter of fact, I'll throw in, just last week, I had a call from a constituent in South Carolina. They have a very rigid 4-year degree requirement there. They registered one surveyor last year.
Oh.
And they're just floundering. They're not producing surveyors. Now, why in the world would that get passed? Because of faulty surveys being put out into the general public and all the problems created by that. And as surveyors, we're faced with dealing with that issue constantly when we're surveying a tract of land that's got 4 adjoiners that were surveyed by other surveyors. And we end up with boundary line overlaps all over the place, and they have to be resolved. Many times they end up in court.
Mm-hmm.
So there's a happy medium somewhere, and we're trying to encourage the 4-year route and 2-year route. That higher education is going to help that problem versus the high school guys that are just learning the nuts and bolts, as Mark said, but they're not understanding the bigger picture. So hope that answers your question. I'll go to the last slide here. This just kind of demonstrates the compression.
We got another question.
Oh, sure.
We pretty well get it.
Okay,
I think, Senator Anavatarty has a question.
okay.
I apologize, but we've
That's
got
fine.
to move on.
All right.
Thank you, sir, and I'll be quick. As you got 3 buckets here with a, bachelor, associate, high school diploma. If you were to, say what percentage of Georgia surveyors kind of fall into each bucket, what does that look like, just broadly, high level?
I'll let anybody chime in. I'm gonna go with
Probably best. He's seen.
Mark. Yeah, Mark's reviewed a bunch of applicants.
I saw most, if not all, the applications for 18 years. And there was a trend that wasn't consistent in 03 as it was in 21. In 03, it was mostly high school route that took the college courses. And honestly, they didn't have a real high pass rate. They struggled to pass. But what I saw near the end, which I hope answers your question, is I believe now probably around half. Well, to answer your question, I would guess 10% or less of land surveyors going into to be licensed now, not that were licensed 20, 30 years ago, would have a bachelor in surveying or geospatial science or something that's very on point. It used to be probably 70% or so that were high school. Now that's probably in the 30 to 40% range. The bulk of, I'd say roughly half or a little more than of the people that are trying to enter now have bachelor degrees, but they're in different fields. So they get kicked under the current code over to the associate degree route and these extra delays. And that's discouraging them from entering that. So, we've got a pretty good crop, but we need to make it more conducive for them to be able to stay in. So that's where we're at, is probably at the end, a third that get licensed, probably the high school route, close to half for a bachelor degree in something besides surveying, and a small fraction have the actual surveying degrees.
So if we had to get surgical to fix the problem, it's fixing that bachelor associate kind of piece, have more efficiency to get them through the process system.
This will make it
Ready
more
to
efficient
go,
for those
and
ready to
then
go sooner.
High school seems like it's a little bit more cumbersome in terms of getting to a passage and all that. But right now, if they're coming out of another field, instead of kicking it back to associate, is there a way to kind of tinker with that to?
Actually do it.
Okay, got it.
That's what this does. Is a lot of states, including our current code, only recognize a degree in
Right.
surveying, and we realize that's someone that's got a bachelor in business, got 120 hours in business. Then
Right.
they get 18 semester hours in survey. Now they got 138 hours. They've really got more than the 120-hour guy with the surveying degree,
Right.
and they're better prepared to communicate, serve society.
Got it. Thank you. Thank you, Mr. Chairman.
Decoupling will also drastically increase the pass rate of that high school guy, because he's got so much more experience on the back end that he's got to get that the others don't, and less education.
Got it. Thank you.
I really appreciate you all bringing this idea to us and trying to solve your own, bringing us a solution versus just coming and telling us how bad everything is or whatever.
Senator, a quick comment. We figure if we don't find a proactive solution to make this better and keep Georgia the best state in the nation to do business, y'all will find a solution for us. So we might not like it.
Well, we're powerful in the Senate. We did change the center of the earth
Oh, yeah,
a
that's
couple of
right.
years ago. So that's pretty
I don't
strong.
know. Less laws are always better though.
All right, thank you very
Thank you.
much.
Appreciate it.
All right, now we're gonna move on to health, back to healthcare. Robin Pinchton with the Georgia Nursing Leadership Coalition. Thank you, Robin. And we're gonna set the clock.
Good morning, and thank you for having us. My name is Robin Pinchton. I'm a family nurse practitioner. I'm representing on behalf of Georgia Nursing Leadership Coalition. To start the presentation is my colleague Beth Harrison.
Good morning. My name is Elizabeth Bolton Harrison. I'm a previous outgoing public policy and legislative director for Georgia Nurses Association. And as my colleague Robin said, we're representing the Georgia Nursing Leadership Coalition. And so we're part of a group of organizations, Georgia Nurses Association, including United Advanced Practice Registered Nurses, Georgia Associations of Deans and Directors and Nurse Educators, as well as the American Association of Nurse Practitioners. And what we're doing today is presenting information about challenges that we're having with licensure board with the Secretary of State. And also we'll delve into some issues and challenges with the composite medical board for APRN practice. Let's see. Okay. So by the numbers in the state of Georgia, we have, as of yesterday, 171,982 nurses in the state. Of those, LPNs make up about a little over 28,000. Nurses, registered nurses, 143,342. And of that, we have 21,702 advanced practice registered nurses, ranging from nurse practitioners, CRNAs, nurse midwives, and CNSs. As we look at the workforce data accuracy, you see there's some discrepancies between what the Georgia Board of Nursing is reporting, which are the numbers that I just described, in addition to what the Secretary of State have is about not quite 10,000 less as far as those discrepancies. Now, when we take the slide, we're looking at the revenue that's generated by the licensure board. And so you can see that it's a little blurred on this slide, but you can see a listing of all the fees that are associated that nurses would have to pay to become licensed in the state of Georgia. What I want to highlight is that with license renewal alone, of the nurses and the nurse practitioner or APRNs of the state, they're paying $70 per renewal amount. This generates $11.87 million in contributions to the state's budget. And so, like I said, this is just license renewals. And if you take that 21,000 APRNs from the state, you're going to, that's another $70 for renewal. You'll get another almost 1.5 million that supports the state budget. So you all, being state senators, you all are aware that the Board of Nursing has 13 members appointed by the governor, and they're responsible for the regulation of our practices for APRNs, registered nurses, and LPNs alike. As we look at nursing workforce data, the Board of Nursing, we're excited about this because we've really had challenges about getting accurate information. We're requiring nurses, when they renew their license, to be able to collect this data. And this was done by the authorization of House Bill 1013 in the 2022 legislative session. So right now, the Board of Nursing is preparing to create the documentation to be able to collect the data. So we actually know where nurses are working. So the difference between a nurse being licensed in Georgia but working in Florida, we'll have a little bit better, more information. And that way, as far as determining where we need to put nursing staff and where we need to focus our efforts on, this will allow us to get more accurate information for this. And when you look at the Georgia Board of Nursing staff, the day-to-day functions, you have 8 staff members. And when you think about 8 staff members having to support over 170,000 professionals, this is not enough. You have an executive director, you have a licensing supervisor, and 7 licensing analysts. So if you look at their staff expectations, a licensed analyst should be able to process 15 new nursing license applications per day. So you're talking about 7 specialists at 15 per specialist. That's 105 per day. And if no one gets sick, take off work, goes on vacation, over 260 work days per year, you have 27,300 applications processed. And the current timeline is roughly around 15 to 20 days for the barring there are no application deficiencies. So in perfect world order, they can get this many done. So if you look at this slide, and let me just briefly back up. So this slide also gives you some raw data as far as the applications that were received and the license that were issued from 2013 to 2023. And going back to the next slide, the nurse, if you look at this line graph, so it's a little difficult to see, but you can see how over the course of the years, the number of applications that these analysts have to process have increased. And if you see the very bottom, that blue line there, you see that the staff for the Board of Nursing is flat. So they have been asked to do more with the same amount of staff and haven't had their workforce increase over time. In addition to the staffing analysts, we also have the phone calls for the call center. And so all the nursing related inquiries that come into the professional license board's call center are being answered by people who have to answer all the other 42 licensing boards. So nursing does not have a specific call center of people that are dedicated to be able to address and answer those questions specific to nursing licensures, which can be difficult. Here, we're going to discuss the nurse educator position. And so the nurse educator position is important because this position will go in and assess the 88 nursing education programs that are currently in the state. And that doesn't include any nursing programs that are working to come online to help prepare nurses to help take care of the people of Georgia. So they have to schedule and plan and coordinate visits to existing nursing education programs, interviewing administrators, reviewing programs, evaluating their curriculum to faculty partners, also doing site visit reports in addition to monitoring the NCLEX or the National Council of Licensure Examinations reports for each individual institution. Another challenge that we have are nurses with discipline orders. And so with the Georgia Nurses Peer Assistance Program, that's a partnership with the Georgia Nurses Association and the Board of Nursing. It was established in 1981 to be able to help support nurses with disciplinary orders for the challenges that they may have in order to be able to counsel them and rehab them to be able to get back into the workforce. Georgia was the first state to acknowledge this as an issue and need to treat and support the nurses that are having substance abuse challenges. One of the challenges is when they're placed in a discipline order, although they're rehabbed to be able to get back into the workforce, it becomes very difficult for them to find jobs because of their history of substance abuse. When they have been placed on the we have alternative to discipline programs that are currently in the nation that work to help get nurses back to their jobs without the punitive issues that come with the disciplinary order. ATD programs, they'll receive 75% more enrollees just because people are more willing to be able to subject themselves to be evaluated and treated, knowing that there is not the burden of having the stigma on them as having a disciplinary order. In addition to that, more than 80 states have now the programs for alternative discipline orders, and Georgia is unfortunately, one of 5 states that does not have a discipline program in place at this time. So with this information, our recommendations to try to address some of the challenges that we're experiencing in the state is to be able to make sure that we're responding to the licensed nurses of the state of Georgia, being able to support them and ensuring that we have people that are educated and prepared and ready to serve the constituents that you serve. We want to respond to the state's roughly 170,000 licensed practitioners, facilitate license and relicensure process in a uniform and timely manner in order to get people to work. We also want to provide a comprehensive collection of data for workforce data so that we know where do we need to gear our resources and manage the disciplinary process for nurses, in addition to regulate and ensure that all nursing programs have quality education. So a few of the recommendations we've discussed, and I think you all have heard with the Secretary of State's Georgia Works program, is adding additional licensing analysts, and that salary, and this is listed within the state, is $44,000. We need to develop a designated call center representative specific to nursing licensure. We also want to look at getting a part-time workforce data analyst to be able to help us collect the data, as I stated, to be able to understand and know exactly where we need to target nurses to support within the state. We're looking at part-time nurse educator to be able to support the nursing educator role, to be able to evaluate and track the 88 nursing programs in the state. In addition, a nursing to alternative discipline program with an estimated overall budget of $750,000. So even as we're looking at these recommendations and the price points for them, we have to go back to the revenue that's generated by the nursing licensures with the state. Again, just with licensure renewal alone, we have over $12 million that it's generated that would be more than enough to support the recommendation of the programs that we have. Bless you. Also, we have some pending legislation coming up when we look at House Bill 520, the Mental Health Parity Act. This passed the House back in the 2023 legislative session and is currently sitting in the Senate HHS committee to be picked up in 2024. This bill will allow us to get the expansion of data collection for the state for workforce. It'll also allow creation for the Alternative to Discipline program. There's also Senate Bill 164, which was a PRN licensure legislation bill that actually passed both the House and the Senate in 2023, but due to constraints in being able to initiate the bill without compromising APRN licensure, it was vetoed in order to have a deeper look to make sure that we're able to get that done without impacting care that were provided. And as we, and I will transition, allow my colleague Robin to speak about APRN licensure.
Thank you. Okay, so licensure, currently in the state of Georgia, we do not have a license to practice an advanced practice registered nurse. We have an authorization to our RN license. So this can be very confusing, especially when we sign our name and our license number. Our license number has an RN in front of it, and a lot of documents get kicked back saying that this is not accepted because we need an APRN signature. So that RN in front of our license number causes a lot of confusion, a lot of backlog and time. So we're only one of 11 states that do not allow, have a separate license for the APRNs. We do have legislation, as Beth mentioned, it's going to be reintroduced this session. So I like this map. This is a state of the state map. This compares all the states and where they are with their restriction. Green means full practice authority, means there's very, very few restrictions. They can practice to the full scope of their education. And again, that's what we're talking about, full scope to our education. We're not talking about increasing our scope. Yellow is more restricted. Red is very restricted. We are one of 11, and we are the most restricted in the country. And because of this, because we're restricted, we have something called the Collaborative Practice Agreement that we're going to get into more detail, but that kind of restricts our practice. In your packets, you will find a copy of the Collaborative Practice Agreement. You'll see it's about 9 pages long. When I first started 25 years ago, it was about 2. Stuff just keeps adding to it. It's a very confusing document. It's not well understood. And because of that, it's taking about 6 to 8 months for an APRN collaborative practice agreement to get approved by the Board of Medicine. And this is causing a delay of entry into the workforce for APRNs. So this slide just goes over, reviews the education process for how we enter practice. I'll let you read that there. Also, what I have in your packet is I have several maps of state to the state that show where Georgia stands. If you'll see, there's one on prescriptive authority for emergency Schedule 2s. We're one of 2 states that are not authorized to schedule an emergency. This is a 2 to 3 day supply of emergency Schedule 2s. It's us and Oklahoma. We are one of 2 states that cannot sign handicap stickers. We're fighting it out with South Dakota for last place. Now the handicap sticker has to be notarized as well. So if you're in a busy primary care office, right now with the paperwork, the insurance companies, the pharmacies, our paperwork is in a huge backlog. So everything that has to sit on the physician's desk to sign just creates more of a backlog and delay in care for our patients. Also, I believe I included the map of home health. We're one of 11 states that cannot authorize home health. The CARES Act allowed a lot of states to sign the research and certifications for home health. Georgia is one of 11 that cannot. We're also one of 11 that cannot sign POST forms, which is physician's orders for life-sustaining treatment. Okay, next. Yep. Now, the problem with being so restrictive in Georgia and taking 6-8 months to get our collaborative practice agreement passed is that a lot of nurse practitioners are finding that they like to work in a less restrictive state. And we have owners of large telemed companies telling us that they will have a nurse practitioner with a Georgia license sitting in their living room in Alpharetta, but they choose to only take assignments in Vermont where they also hold a license, but are less restricted. So they prefer to work in a practice in a state where they're less restricted. So I do have a testimony here that I would like to read quickly. And this is from former Senator Renee Unterman and Senator Walker. She says, hello. So she was in an urgent care in Andrews, North Carolina, and she writes, I am sitting in an emergency primary care clinic 50 miles from the Georgia-North Carolina state line. There are no practicing physicians in the surrounding communities. My clinician is a nurse practitioner who lives in Hiawassee, Georgia, 50 miles away. She prefers to practice in North Carolina because it is less restricted. These areas are designated rural practice areas. Our needs, I can't read the rest, but it is a shame that the lack of healthcare professionals in Georgia, the ones that we do have choose to cross state lines to practice in another state. So that's from Senator Renee Unterman.
Thank you, Robin. And if Senator Unterman's watching, hello, hope you're doing well. She chaired the Senate HHS committee for a long time and did a great service to the state. Robin, I'm going to kind of cut you off there, but in case we have some questions for you, anything, Senator Anavatardi?
Yeah.
What's your mic number 5?
Number 5.
All right.
Thank you for being here this morning. So one question I have, I mean, I guess in some ways it's kind of the obvious why, in some ways, having the alternative discipline program kind of buried in House Bill 520. What was the thinking of maybe not having that as a standalone bill? I mean, I get the behavioral health substance issues with that from a policy perspective, but if it's a workforce, issue, a goal, why not do that as just a standalone bill?
I mean, and that's a great question. And so if Tim Davis is here, he's with our Georgia Nurse Association. He's our legislative chair. As far as being with this, I think it just kind of, with the mental health parity bill, this goes along with substance use abuse disorders with mental health. It got added on to this bill. But Tim, I don't know if you're able to opine about a little bit more. Mm-hmm.
Well, I mean, I'm just saying, I mean, it's kind of, I mean, probably half our colleagues don't even know this is probably in 520. I mean,
I agree. I mean, it seems like it would warrant its own discussion and its own debate instead of being part of such an omnibus bill.
Yeah, because I mean, I would be interested to know. I mean, I see there's only 3 states, 4 states, 5 states that don't have it. But I think under the circumstances, and I mean, these are frontline individuals who are experiencing everything under the sun, good, bad, ugly. And we all know the personal toll and impact that has on an individual, workforce, and family. So, I mean, to me, I think this is my own opinion, but I mean, I do think it's probably more of a, workforce lens from that perspective. But I do think, Mr. Chairman, at some point offline, I would like to have further conversation, just learn more about the background of kind of why is this buried in 520? But that's my own question.
All
Or
right, thank
thoughts.
you.
No,
Thank
thank
you.
you for that.
I've got a couple questions. One, you talked about staffing at the nursing board. Do you have any data or statistics or comparison of what staffing levels other states of similar size as ours have for the nursing licensing?
I do not have that in this presentation, but also Tara, who's here with the Georgia Board of Nursing, she would probably be better. We can get that information better suited for comparison data.
Have specific data, right here with us, but I can definitely get it for you. I can tell you that we are very low staff compared to other states.
If you would get that, that'd be helpful if we decide to introduce anything relative to that. I mean, that's gonna be an obvious question, I think. On the emergency Schedule 2 prescriptions, I'm pretty sure we passed that out of the Senate. Did we not?
Yes,
When was that? 22 or
it was this past session.
so it's still alive?
I'll let Juliana, yeah.
Yes, ma'am.
Yes, that passed out of the Senate, but it had started and then it also passed out of the House, but there were changes made and it's in a conference committee right now. And so that conference committee will be meeting and our expectation and hope is that it will be coming out quickly when the session starts. And it just has to be approved by both the House and the Senate to the changes made in the conference committee.
Great. All right. Thank you. Anything else, committee? All right. Very good. Very great information.
And Senator Walker, if I can just briefly, your first presenter that was talking about the program with military. As a former Navy nurse, I think I've worked with plenty of hospital corpsmen that have done extremely good work. And so I'm very interested in seeing that go forth in Georgia to help support our staff in the hospital.
I am too. Thank you very much.
Thank you for having us.
Thank you for what y'all do.
Thank you.
All right, next, we're going to hear from the Licensed Professional Counselors Association, Gail Mackey, who's their executive director. And I learned at the Georgia Works meeting, it's 3,000 hours for experience, I think, for a licensed professional counselor. Is that right?
Yes, sir. And I also
Seems
want,
like a lot.
well, I do want to thank y'all for passing in 2021 the Professional Counselor Compact Licensure Law. In 2021, 10 states were needed. We have 30 signed on now. And this coming summer, the committee will have the national rules. So Georgia was the first state in the United States to pass the Professional Counseling Compact Law. So pretty excited about that. Thank you. And then I
Must
also
have
want,
good representation at the Capitol in Juliana.
yes, we do. Thank you. And then another amazing thing that y'all passed for us in 2022 is you reduce the hours required for the internship after you graduate with your master's degree or higher. We were at 36 months, which the rest of the United States had reduced down to 24 months. So thank you very much for passing that. That really made a big difference. So y'all have already worked really hard with us on reducing the barriers to licensure. So I decided I'd start out really early here and fast because I know we're sort of out of time. There are approximately 2,500 psychologists in the state and approximately 8,600 licensed professional counselors. So what we're asking for is just 4 simple points. The first one is a math conversion. 60 semester hours equals 90 quarter hours. And in the law, it says 80. We didn't really catch that when the update happened. So our chapter has not been updated. It started in the late 80s and was not updated until about the last 2 or 3 years. The other thing that we're asking for is to go ahead and add the national accrediting body for professional counselors. You'll see in our chapter that it lists the national body for social workers and the national accrediting body for marriage and family therapists, but we would like to add the national accrediting body for professional counselors. One other thing that in House Bill 291, that's the one from last session in which the court systems, the judges asked to add more professionals for guardianship at this time to do a mental health evaluation for a person entering in guardianship of this under the state of Georgia. The only two professions that were allowed were social workers and psychologists. There are 3,000 social workers. There are 2,500 psychologists. So by adding licensed professional counselors for House Bill 291, you would be adding a workforce of 8,600 people more available for that. The court systems are backed up by 6 months or more. So again, what happened with the profession, which is only about 40 years old, the education went from 32 hours master's degree or higher up to, we're now at 60 semester hours to graduate with your master's degree or higher in clinical mental health. So as you can see, the education has across the United States has increased. So again, thank you all for reducing 24 months of internship in order to apply for full licensure. So I know the last items are removing the restrictions on diagnosing and testing. They were added in 2016. There was a debate on whether or not this was necessary. Again, the law was created in the late 80s. There were virtually no issues on diagnosing and testing. In 2016, it was added. We'd like to have it go ahead and have it removed. So if you have questions.
All right, Senator Evertardy.
Thank you for the presentation. Thank you, Mr. Chairman. Who added the language in 2016?
Trying to remember the House of Representatives. He's a mayor in Toccoa Falls now, and I can't exactly remember his name. His wife was a school counselor with a degree in psychology.
Okay, I'm just curious. Yeah, I'd be curious to see who added and why was that added. And then you going back to your previous slide, you said this piece about adding to the law, that was as part of a judge's ruling, or the judges are asking? Say that one more time.
Yes, House Bill 291 was
Right.
adding additional providers to the current list because the current list only has LCSWs and psychologists, and they're just not enough in the state. And again, the licensed professional counselor's education degree went from 32 hours. It is now at 60 hours. So they do have a semester on testing. They have to have a separate semester on diagnosing, and then they have to go out in the field and practice for a minimum of 24 months. They are allowed up to 60 months because life gets complicated. So they do have that option that if life is interrupted, they can continue working towards their license, and they do have to pass a national counselor's exam. One thing that licensed professional counselors also have to do to graduate, they have to take an exam, or they don't get their.
I think she said a request from judges.
Okay.
It wasn't a court order or anything.
Okay, I'm sorry.
I don't believe.
Correct.
Okay.
It's a request. House Bill 291 is the request, sir.
Okay, thank you.
Senator Halpern. Thank you very much.
Thank you.
All right, I'm gonna get out of order here because I think Megan Forbes will tie a ribbon on some of this for us, if that's all right, and go ahead and ask Rusty Ralston to come speak to us from the Soil Science Society of Georgia.
Thank you, committee. Thank you very much for having us. We ask for your indulgence as we are rookies at this. And if you think you had a lot to deal with this, we've got very little because our numbers are probably the smallest of any group here represented today. I want to introduce Patrick Davies. He's from Valdosta. I live in Blairsville. We both serve on the Soil Classifier Certification Advisory Committee for the Georgia Department of Public Health. Patrick is our chair. For those of you who don't know, as soil scientists and soil classifiers, our main purpose is to provide soil and site evaluations for on-site wastewater applications. Majority of our work is for residential and commercial septic system permitting. We also work on large community drain fields. There's a lot of things that we do, but our main certification is through the Department of Public Health. And in the state law, we're going to get to this a little bit. There are requirements that we're looking at trying to changed a little bit so that we can increase our numbers as well. If you'll notice on the, and I think you should have this in your packets as well. I tried to gather as much information as we could from the Department of Public Health. So what you're seeing here is the number of actual soil classifiers that have been certified in the state. This chart actually begins in 2004. But our certification program actually began in 2000 with a legislation that created this whole program with the Department of Public Health. But if you'll notice on there in 2004, we were right at about 60 soil classifiers that were certified by this Department of Public Health. And if you look at the very end in 2022, which is the last bit of data I've got, we have exactly the same number. This is a critical issue. You also see that there was a spike or peak right around 2006. Of course, that was the height right before the Great Recession hit and the housing market got hit pretty hard, which of course hit our numbers pretty hard as well. On the next slide, if you'll see that there is, these are the number of septic permits in the state. This ends at 2021, but it begins at 2012, which is after the Great Recession and things started to come back up. You'll see those numbers have increased. And there's just a little bit of a spark down in 2021. But that number, I think, is kind of maintained at that level. So if you go back to the last one and you see that chart and the number of soil classifiers trying to meet and do the work for those many septic permits, it got a little hairy there for a while. We're not the only ones that perform this work. Registered engineers or licensed engineers that are performing in their area of competency, as well as geologists, can do this work. And if you'll notice, I believe geologists is the orange number, or the orange line rather, and engineers are the gray line, soil classifiers are the blue line. There's more soil classifiers out there, but they have flatlined as well as trying to get people into doing this particular type of work. And you'll see the total number up there. We've managed about 120 folks trying to actually perform enough work to get these 18,000 septic permits done a year. The other issue is, and I'll just be frank with you, we don't have any data on this, but the median age of a soil classifier in the state is probably around 50. And so we're not doing enough to bring people into our profession and trying to raise this up. This has been an ongoing concern, and we've decided to try to make some movement in that direction. So if you would, on the next slide, you'll see exactly what's required. Currently by law, you must have a Bachelor of Science degree to be considered. You must have 30 semester hours of physical science and 15 semester hours of actual soil science coursework. And this is actually in the state law for what's required. And we're not proposing any change there. We think that that's appropriate. And a number of our folks that are coming into the profession actually have a Bachelor's of Science degree and are going back and getting their coursework. And there are online opportunities for them to try to get that rather than trying to get to a physical place to have that education. You'll see in the examination area, there's a field exam that's required. There's a written exam for the regulations for the septic system permitting, the Georgia manual, if you will, of on-site wastewater management. And then there's another written exam. And currently what we're using is the Fundamentals of Soil Science exam that is administered by the Soil Science Society of America. We see this as a potential problem. I can tell you, I took the test. I had been out of college 20 years when I took it, and I had to take it again because I didn't pass it the first time. The real reason why we're looking at changing this particular part of the program is that what we do is very specific. We get out on a piece of property, we dig holes, try to get out about 6 feet. We're trying to do a map. It's very, very focused on that. The chemistry and microbiologists involved in the soils is already assumed in the work that we do. So we don't actually do any kind of measurement when we're doing these type of evaluations. It's important to have that background through our academic program or work, but we don't see a need for that. This test, this fundamental soil science test, actually requires a serious examination of soil chemistry, soil microbiology, soil physics, things that sometimes we don't actually do in this field. When we started in the program in 2000, I was part of that first wave that got certified, and we actually used a state administered test, and we're reviewing that possibility of going back to that now to try to reduce that effort. We have I'm not gonna give any names. We have one young man that's taken this fundamentals exam 3 times and he can't get through it, but he does great work. So it's a stumbling block for us. But the one that we're dealing with the most is a 4-year experience requirement. And it's not that it's that requirement, it's the requirement that it happens after the 4 year of the full education requirements have been completed. So in other words, if we have somebody come in as an apprentice or somebody that starts working for somebody before they've completed their education, none of that experience can count towards getting your certification through the Department of Public Health. We see this as a problem because a lot of people don't even think about soil science when they're in college. But once we get somebody out into the field and they see what we're doing, they like what we do, they want to get interested in it. And sometimes it'll take them a little while to be able to get up to that point. We see that as an obstacle that we're trying to change. So what we want to do is change it to keep the overall 4-year total requirement, because we believe this, and we've discussed this as a bunch of colleagues getting together. Other states do it differently. There's some that are 5 years. There's some all the way down to 2 years, but we believe the 4-year requirement total is useful. But what we'd like to do is to take and change that to 2 years after the education requirement has been completed instead of the full 4 years. We believe that this will help us get more people interested. There are other things that we need to do. This is not the only thing that we need to do to get people interested in soil science, but this is probably one of the ways that we can help. And this is one of the ways we see that through legislation, we might be able to make that change. And I'd be glad to have any questions that you might have.
Thank you. So you're not under the state professional licensing boards, you're under the Department of Public Health.
We're a certification program through the Department of Public Health. Yes, sir. And
your industry, do you often see people that do the soil exam or classification also do the monitoring of like the runoff and all that? Is that normally?
There are some that hold both of those certifications. They do erosion and sediment control type of work.
And is that under Department of Public Health too?
No, sir. I still think that's under EPD, DNR.
Okay. I mean, I don't know how it was 60. I don't know how y'all are doing it. And
well, you see what's happened to me.
Is it a compensation issue too, or?
We've heard stories of folks coming out with a degree in water and soil science out of the University of Georgia. They've gone through the whole program. I think Patrick's had experience with this, that that's an internship requirement as part of that degree. They get out there, they work it for a while, they decide they don't want to do it. So it's not an easy field. You're outside, you're dealing with all the parts of the environment that could be bad, from weather to insects to snakes, the Juro spider, which is now moving northward, thank God. It's a terrible thing. But what we're seeing mainly is that we're not getting enough publicity out. And then when somebody finds out about it, or they go out to the field with somebody, or they're trying to get their house built and go out and get a permit, and they find out they've got to have a level 3 soil survey. Can I be out there with you? Yes, please come out there with, oh, well, this is kind of a neat idea. I wish I'd known about it. Then they find out what the requirements are. And by that time, they're no longer interested in trying to pursue it. Essentially, it's about an 8-year process, a 4-year degree and 4 years of experience right now to get there. I actually have a young man working for me that was working for the U.S. Army Corps of Engineers as a wetland regulator. And he has experience understanding and looking at landscapes and landforms and making those kind of calls. As it stands now, none of that experience can count for him to get a certification. So those are the kind of people that we're looking at. And he was actually somebody that went out with a soil classifier to look at how a soil and site evaluation occurred when he built his house in Hiawassee. So
I think the market will determine that compensation. I think it's fair. I mean, I think we're fairly compensated for what we do. We had 2 interns this summer, and you know, this would help count some of their experience, you know, this summer and next summer. And honestly, most of our on the job experience really is what pays off in the long term.
All right. Thank you all. Any questions?
I kind of feel like we do a bill. We ought to call this the Pike Nursery Bill. Yeah, this is good stuff.
Great.
Thank you all.
If
All
there's
right.
anything else, please let us know.
Yes, sir. So before I call up Megan, I do want to point out, we've got some information in the folder. Hold on a second. You'll see, committee members, there's a document in here with the FGA at the top of it. This group wanted us to be aware of their recommendation. So this group wanted us to be aware of their recommendations for licensure reform, but they weren't able to come present. And I told them we would make you aware of this, let you read it at your convenience, and kind of enter it into the record. So I want to go ahead and officially do that. And then we have another really, I think, good document with just shows where Georgia is. At the top, it says a snapshot of occupational licensing in Georgia, and it's got some recommendations and reasons why reform is important, and some ideas there, and it includes a pretty big spreadsheet of all the different licenses we have, what the fees are, and that kind of thing. So just for your reading pleasure at a later time, but we'll have that in the official record. All right. So to really bring all this home for us, this is I think, is this our third meeting? So this is our third meeting. We're going to have a fourth meeting before we go into special session. And at that meeting, we'll have maybe one presenter is all, maybe two. And then we'll discuss some recommendations. We'll vote on recommendations, and then we'll have a report, which is due by, I think, December 1st. Is that correct? We could probably ask for an extension, but I'd rather not. So we're kind of trying to get a high level view of where we are with all this licensing stuff. We've heard a lot from specific industries and their concerns, but Megan, I think, can sort of bring all this home and kind of tie it together with how this is impacting our workforce in Georgia, our economy in Georgia, and opportunities for Georgia citizens. And so I want to call on Megan Forbes. She's the Director of Legislation for the Institute for Justice.
Good morning, and thank you, Chairman Walker, for inviting us to speak today. I also have with me Jamie Kavanaugh, who is a legislative counsel and attorney at the Institute for Justice. And we have Diamond Cherry with us, who is a makeup artist here in Georgia, who's going to talk in a little bit about how the licensing laws are impacting her. So my colleague Jamie is going to begin the presentation today.
Thank you.
Thank you, Megan. And I am just going to talk for a couple minutes about the lactation consultant license case, because I had the pleasure of litigating that case. And the clicker is not working. Let me do this. Okay. Thank you. So you all have heard a little bit briefly about the case from another presenter, but what I wanted to talk about today are kind of the implications moving forward and what the General Assembly should be thinking about as a result of this case when it thinks about either creating new occupational licenses or reducing the burdens associated with existing licenses.
Jamie, you've got a voice that to me doesn't carry all that great. I'm having a little trouble. Get that microphone up to your mouth. Good. Thank you.
Absolutely.
Very much.
Sorry about that.
All right. Thank you.
Yes. Okay. Let me see if. There we go. Thank you. Okay, so I'm going to start by talking just briefly about our case where the Georgia Supreme Court struck down the license for lactation consultants. Lactation consultants are women who teach other women how to breastfeed. They are generally just giving support and advice in the first few days or few weeks of a baby's life. They're not doctors, they're not prescribing medication, they're not diagnosing, they're not treating any diseases. And they all are trained. They take different private training courses, but the license in Georgia singled out one of several different types of training courses and said, it doesn't matter what training you've done before. Now, to be licensed in the state of Georgia, everyone has to do this one specific type of training. And Georgia was the fourth state in the country to adopt a license for lactation consultants. Most states don't license lactation consultants, but they work in private practice, they work in hospitals, they work in physicians' offices because their employers trust the trainings that they all do. And even before this license was adopted, the Georgia Occupational Regulation Review Council reviewed the proposal and recommended against licensure. It found that there was no instances of harm to Georgia families as a result of unlicensed lactation consultants. And it actually said that licensing lactation consultants would harm the public because it would reduce access to lactation care and services. So when the court took a look at this case, it said a few really important things. And first of all, it said, the Georgia Supreme Court said that in Georgia, our Constitution protects the right to earn an honest living. We call that the right to economic liberty. The court protects that more than the federal Constitution. So the Georgia Constitution is more protective of that right than the US Constitution. And that's a really amazing, wonderful thing that we know happens here in Georgia. But that means when the General Assembly wants to pass a law to restrict someone's right to earn a living, then it has to kind of have a few barriers in place and boundaries in place so that it doesn't overstep those bounds and infringe someone's right to earn a living and go beyond the bounds of the Georgia Constitution. So the court set out a new test that the legislature can keep in mind when it's creating new licenses or when it's thinking about reducing burdens associated with existing licenses. So the first thing that the General Assembly has to provide is a legitimate interest or reason for licensing a profession. If you're thinking about creating a new license, what's the actual public harm that's happening? So here, the court said that pure economic protectionism, protecting one group from economic competition, would never be a legitimate government interest. Federal courts have actually said that is a legitimate government reason to regulate and license, but that's not true in Georgia. And the court also said that general quality concerns are not a legitimate government interest or a good reason to license. You can't say we might have better quality if we license a profession, because that's true of any profession. So you need an interest that's unique to this profession if you want to license a new profession. So if the government can't show a sufficient interest or reason for licensing a profession, then the new license would be considered unconstitutional by the court. But here, the General Assembly said, hey, we want to increase access to lactation care and services, and we want to make sure that services are safe. So the court said, yes, on its face, that's a legitimate reason to create a license. And so then the burden flipped back to my clients as the challengers, and we had to show that the license was unreasonable in light of this specific stated government interest. So did the means that the General Assembly chose, the means for regulating, did they fit kind of the end goal in place? And here the court said no, because the facts that we had showed that there was no evidence that anyone had ever been harmed by an unlicensed lactation consultant. There was zero evidence of that happening in Georgia or anywhere in the country. And we had the information from the Regulatory Review Council, as well as other information in the record showing that licensing lactation consultants would actually decrease access to care instead of increasing access to care. And so here are some of the real world harms from licensure that the court considered during this case. So by licensing lactation consultants and forcing tons of women like my client, Mary Jackson, who had worked as a lactation consultant for 30 years, she didn't have the right training. So she would have had to stop her job, go back to school for 2 years, take an expensive exam just to keep doing a job that she'd already done for 30 years. So by putting tons of women like Mary out of a job, of course, it would have decreased access to care, but that would have been felt most in rural and minority communities where people with this one specialized type of training don't tend to be located. Some of the private entities that offer different various types of lactation consultant training just stopped offering courses in Georgia. So now there was a decrease in access to education. Some employers, even though the license never was enforced, some employers started asking the unlicensed lactation consultants to stop working directly with mothers and babies. This wasn't because the law was in effect. It was being challenged in court, and the Secretary of State had agreed not to enforce it during the lawsuit. But the employers were still taking these actions, so it was still having the same effect and impact on the ground. And some hospitals actually stopped hiring lactation consultants that didn't have the training that wouldn't be eligible for licensure in the future. So there are a lot of other effects that can happen and harms that happen as a result of a legislative decision to pick one single type of training. So now I'm going to hand it over to Megan to talk about some legislative solutions.
Thank you, Jamie. So I'm going to talk about IJ's research on occupational licensing and offer some practical strategies for reform based on best practices that we're seeing right now in other states. So I'm going to start by talking about our research, License to Work. License to Work is a national study of the burdens from occupational licensing for 102 lower income occupations across the country. We looked at burdens across the board in every single state for the 102 lower income occupations that we identified. And we had a few key findings. We found that for these lower income occupations, licensing is widespread, it's burdensome, and many of the burdens are questionable at best. Overall, we identified more than 2,700 occupational licenses across the country. And we also found that licensing is not universal. Among the 102 lower income occupations that we studied, most are unlicensed by at least one state. So 88% were at least unlicensed by one state. And licensing requirements often appear unrelated to health and safety. In fact, all of these occupations here require more training than an EMT. That includes cosmetologists, painting contractors, skincare specialists, and auctioneers across the country, all of these bars in green. So how did Georgia do in our report? Georgia ranked 35th overall, with first being the worst out of 50 states. And there's one thing that we found that was particularly concerning in Georgia. Georgia ranked 12th for its average licensing burdens, again, with first being the worst. And this is concerning because these burdens are the burdens that disproportionately impact lower income workers the most. Another thing that we found concerning is that Georgia's licensing burdens actually grew worse over time. On average, Georgia's licensing fees and state-mandated education and training all increased. So in our research over the years, we've observed a lot of problems with licensing, and I know that this committee has been hearing a lot about the problems with licensing over the last few meetings, but not everything that states are doing right now related to licensing is bad. Our research also shows that states are starting to take licensing reform seriously. So I'm going to turn to talking about some of these best practices that we're seeing right now across the country because they show what's possible for Georgia. So let's start by looking at the big picture. There are three things that we're seeing states doing right now to reform licensing laws. We are seeing states implement sunrise and sunset review processes to review proposals for new licenses and existing licenses to make sure that licenses are narrowly tailored to protect against credible evidence of harm. We're also seeing states considering less restrictive alternatives when appropriate. Another thing that we're seeing states doing is repealing licenses for occupations that are not necessary to protect public health or safety. And a lot of times that involves looking to see what their neighbors are doing and what other states are doing in that regard. And then finally, we're seeing states paring back broad scopes of practice in licensing laws to exempt safe and common services from licensure. So I'm going to talk a little bit more about each of these strategies for reform in detail. So first, let's talk about review processes. What we've found by looking through our research at state sunrise review reports across the country is that most government reviews do not recommend licensing. 54% of the time, governments are not recommending that a license be created when reviewing the need for a license. They're looking at other alternatives and finding that there are other regulatory alternatives that are appropriate. So we think that this is really promising, and we've found that sunrise reviews can be particularly effective at preventing the enactment of new licenses. So what is Georgia doing on this front? Unfortunately, Georgia repealed its sunrise review process recently, but we think that this creates an opportunity to start fresh. So I wanted to note a few key components of a meaningful sunrise review process. And the same is true for sunset reviews as well, which look at existing licensing laws. Strong standards for guiding the review. So we want to make sure that there are standards that are guiding the reviewers to look for the least restrictive regulation based on evidence of harm. Also, independent reviewers doing the review. And then finally, sufficient time to complete the review. And I just want to note that often that's 9 months, and that's what Georgia had before, which was producing pretty meaningful reports. So I'm going to turn to talking about another best practice, and it's reducing licensing burdens. So nationwide, we have observed that 20% of the licenses that we studied over the last 5 years became less burdensome. So what are other states doing in this regard? They're repealing unnecessary licenses and again, paring back broad scopes of practice. So strategy 2 here is to repeal licenses and reduce licensing burdens for occupations that aren't licensed elsewhere. So we've done a little bit of research on our end. And first, we reached out to the NE Regulatory Research Center of West Virginia University. They have identified 10 occupations that Georgia licenses that are not licensed in 30 or more states. And we've listed these licenses here so you can see them. So we recommend taking a long, hard look at these licenses because when people are working without licenses safely in at least 30 states, the need for them in Georgia is questionable at best. We also took a look at the licenses that we identified in our report that are licensed in Georgia and not licensed in a number of other states. And you can see they range from non-instructional teacher assistant, 40 states do not license that occupation, all the way down to security alarm installer and travel guide. These are also occupations that we think are ripe, occupational licenses that we think are ripe for reform. So the final thing that I want to talk about is paring back broad scopes of practice for licenses for lower income occupations. And we took a look at our report, and the one area where we see a lot of opportunity and also steep licensing requirements is the beauty industry. In Georgia, cosmetologists have to complete 1,500 hours of training and pass 2 exams, and that's 10 times the hours of training that we require for EMTs here in Georgia. It's outdated, and laws like these are in urgent need of reform. And That's what we're seeing across the country right now. We're seeing, when thinking about best practices, states reducing barriers to beauty, to working in the beauty industry. We are seeing, if you look at this slide here, all of the green dots represent reductions in days lost in training. And it's showing positive steps in the right direction toward reducing licensing barriers for people who work in the beauty industry. So what specifically are other states doing? Right now, 13 states exempt makeup artistry from licensing, including Arizona, Florida, Mississippi, and Texas, and 5 states exempt blow dry styling from licensing. And these reforms have a real impact. They create opportunities for entrepreneurship and for people to have their own businesses. So what is Georgia doing on this front? House Bill 212 was considered last session. It exempts safe niche beauty services like makeup artistry and blow dry styling from cosmetology licensing. And we have Diamond Cherry here, who is going to briefly speak about how the licensing laws have been impacting her as a makeup artist.
Good morning. Can you hear me well?
Yes, ma'am.
Okay, perfect. How are you guys doing? So I'm Diamond Cherry. I am located here in Atlanta, Georgia, specifically doing makeup artistry. Me doing makeup, I have started out as an entrepreneur within my experience. I am unlicensed as well, just to make that clear, and I am self-taught. I've been doing it for well over 6 years. I just wanted to let you guys know that basically I'm here to share how the state laws impact the work and ability to earn a living. Basically, the state's licensing laws are driving artists like me into an underground economy where some customers try to take advantage of us and pay us less or refuse to pay since we are not licensed, even though they want our services. I think everyone should have the opportunity to earn a living and pursue the American dream. It is also important for many other people in the state, especially women entrepreneurs like me, who are being held back by those laws and whose lives will change from these reforms. Excuse me. I think everyone should have the opportunity to earn a living and pursue the American dream. It is important for many other people in the state who are being held back. I also wanted to let you guys know that due to me being a makeup artist here in Georgia within these laws, 1,000 hours I have considered looking into school for cosmetology. It's not like that it hasn't been an option for me. The only thing is me as an individual here in this state, I am working full-time as well as a part-time job. And most of the positions available, even if I were to, such as the beauty retailer that I work at now, they can necessarily certify me for doing makeup there. But one of the things that kind of put a burden on it is more of like the cost efficiency and aspects of surviving here in this world. A lot of people kind of take makeup artistry as a profession, such as myself, along with passion, which is something that we need within our community. I do believe that makeup artists and beauty professionals are what keeps our world going in regards to other individuals such as women and men, or even in the film industry as well. I believe that if we were able to assist in making some changes, it would be able to actually bring more artists to make more income, because we do come across some individuals that do feel like, due to us not being licensed within our skill sets, that we do not deserve the pay that we are charging out here in this state. Within Atlanta, because our economy and we have a lot of growth in our city right now, especially with a lot of people coming from other states. I do believe that if we at least lessen maybe some of the hours for makeup artistry, because it does not take a lot of skill. Most of the time, it's more so teaching technique. And I believe if there's just more technique if there was more technique taught within makeup artistry versus just giving basic skill level when it comes to cosmetology, I believe it actually assists more makeup artists in the community better versus having to take 1,000 hours, and majority of those hours is confined to cosmetology, hair, cutting, coloring, styling, things like that sort, as well as only entry level of skincare and things like that. And I feel like if we're at least going to be licensed for our work, we should be licensed in makeup artistry as well as learning other techniques, because it's a lot of versatility in our skill sets that we provide to the community. But thank you for having me and hearing me out.
Thank you, Diamond. Now, is it accurate that the film industry in Georgia has a waiver, I guess, of lack of a better word, that makeup artists working in the film or entertainment industry are not required to be licensed in Georgia?
Yes, Megan did definitely include that to me a while ago, that there is an exemption in Georgia for that. But if you really think about it, it's really hard trying to get into the film and production industry if you're not at least put into the rooms that cosmetology licensing can give you. One of the things that I can say that's great about the cosmetology license, it does put you in an environment to actually have you get to know other individuals and the actual industry, so you can be a part of that. But it's harder for individuals such as myself who are self-taught, because I do not have the means to go to school or have the actual time to attend the schooling, just because it's like $20,000 to $30,000. And again, 1,000 hours is not bad, but most of the school curriculums, when it comes to the hours to attend, it interferes with you trying to actually make a livelihood. And really, even if you were to still be an entrepreneur and take clients while going to school, some of the schools do not allow you to sometimes assist other clients. So that also stops you as an entrepreneur from bringing your own revenue into your economy as well. And I think we're really big into helping the economy grow as much as well. Excuse me if I over answered.
Yeah. So, I mean, the point, it just seems to me, if the film industry or entertainment, digital entertainment, whatever you want to call it, is exempt, it must not be a safety concern. So what is the concern? But anyway, thank you, Diamond. All right.
Thank you. Thanks, Diamond, for speaking to that issue. And I want to mention too that makeup is also exempt at retail locations in the state too, where arguably the public health and safety risk is probably greatest. So it's really when artists like Diamond are going out on their own where they can make the most income, where they're currently disallowed from working without completing that 1,000-hour training requirement. So just to wrap things up, now our clicker's not working, but it's okay. We're at the end of the presentation here. There was one last best practice that I just wanted to briefly mention, but I'm not going to speak very long about it because I know that the committee's talked about it quite a bit, and that's licensing reform for people with criminal records. 40 states, oh, here we go, thank you, have reformed their laws to ease licensing burdens for people with criminal records who are rehabilitated. So we're very appreciative of Senator Strickland for sponsoring this bill. It adopts national best practices, and Georgia would become a national leader across the country if it were to enact this bill. So we thank you all very much for your time today, and we're happy to answer any questions you may have. I also want to mention that our attorneys are available to help with research and crafting legislation if you need any assistance.
All right. Senator Anna Batardi has a question, I believe.
Thank you, Mr. Chairman. I actually have several questions, but I'm going to go quick. On the slide that had kind of the red wheel about licensing is not universal, do you have the sub data that goes with this aggregate data to see?
Yes, we do. So
don't need it right now, but
yeah,
I'd be interested to see what the sub data says, but also too, if you can also produce for the 102 lower income occupations. I know on one of the slides you have some of them. Can you produce the entire list, maybe in rank order of? I would be curious to just see what that is.
Yes, absolutely. So our report licensed work, I have a copy with me here, has all of that data, and also the Georgia specific list of the licenses from most burdensome to least burdensome. And I'll leave this copy here with the committee so you have it.
Thank you. Do you also, on going back to the slide, best practice reducing licensing burdens, do you have any data that shows that in some states that there's a correlation between some states maybe just enacting licenses to create a backdoor to generate revenue or tax, call it sin tax, whatever you want to call it, maybe in those states where the licenses are not needed or required, as y'all talked about? Is there any data that maybe shows that it's more of an income generator versus a quality outcomes driven situation?
Sure. So this report as well shows the licensing fees, and you can certainly see where fees can be quite steep. And we've also seen at the local level here in Georgia that local licensing fees in some of the larger cities are quite steep too, as much as $400 for business licenses, for example. So it's something that's definitely a problem where people who are just trying to work are having to pay these really high fees to start working, which can be cost prohibitive, especially for lower income workers.
Yeah, I mean, the presentation on the lactation consultants in the Supreme Court case, I mean, honestly, again, my own opinion, but that's pretty crazy. You would need a license. I mean, I've lived through that, 3 kids, I mean, all that, and I work in healthcare. But just the dynamics around it, other than it being a revenue generator, I don't know why it would even be needed, because I've never heard of an issue with that workforce or anything.
Right. Well, and with that license in particular, there definitely were trade groups behind pushing it, where it was their certification, right, that would have been mandated. So there's a profit incentive there for the private organization to lobby to get that training that they're offering enshrined in law for everyone to have to do. So sometimes we see private profit incentives too, in addition to
I just don't
public.
think it's right to, levy taxes or some of these licenses on the backs of hardworking Georgians that are trying to do something good for their neighbor or the community. The other question I have, and I don't want to, maybe y'all can answer this. I see George in the audience. Don't want to put him on the spot, but why are there licenses or continue to be licenses in the non-instructional teacher assistant world? And there's only 4 states that don't have those. See, I got you. I would be fascinated. We could talk offline about that. I would just be curious to see, what is that? What does that mean? Like, who are those teaching positions? Well, not teaching positions. Who are those staff positions in school districts or education settings that this is kind of tying back to? Because that, and then I think for our outdoorsmen and women, the taxidermist license, maybe that should go away. I'm kidding. Auctioneer, we'll keep that one. All right. Thank you so much.
Thank you.
Thank you all for traveling to be with us and for offering yourselves as a resource as we try to come up with some good recommendations and hopefully some legislation. But thank you very much.
Thank you, Chairman Walker.
All right, that concludes our presenters. Is there any other business from the committee today? Thank you all for your presence and time. And again, I want to just throw this out for the committee members. What do y'all think about maybe having hopefully our last meeting on November 28th, since we're going to be here on November 29th?
Can we do it on the 29th?
We could do it possibly do it on.
I mean, I don't know. See what time
do you know when we're going to gavel in or anything?
Not yet, sir. No.
So that's kind of what I'm thinking, is either the 28th, possibly 29th. So that we're kind of already coming here or here. But we do need to.
Maybe we'll get a big crowd too. That would be great.
Yeah, we do need to kind
I'll
of
get bonus points, but
I do want to ask the committee members, and I don't know if Senator Strickland's online or not. Has he been? Y'all be thinking about what we've heard over these 3 meetings and and what we might want to put in our recommendations. And I would think what I kind of would like to see us do is maybe kind of look at some low-hanging fruit, maybe the makeup artists, for example, or some low-hanging fruit, and then maybe some more aggressive things too, so that because the hard stuff's hard to get through a lot of times.
I like doing hard things.
But I do want to, I hope we can see some results out of this. I think it's a lot of areas that definitely need some attention. And some of the groups have given us some good recommendations that I think we ought to really take under consideration, but.
I agree.
All right. Well, thank y'all. Thank everybody. Y'all have a great day, and meeting's adjourned.
Thank you.
Thank you, Mackenzie, too.